Heart health
is a way of life.
It doesn't have to be hard.
We're going to help you raise health
and get there.
Because everyone has a unique experience with heart disease, let's start by discussing what is heart failure, and that way we can understand what do we need to do to treat it. The goal of this video is to create a roadmap to recovery. Heart failure is a treatable disease, and there are many options available for us to be able to either stop the progression of the disease or reverse the heart dysfunction. Think of your heart as a muscle that has two functions. That muscle has to relax to get filled by blood and then pumps to push that blood forward. Heart failure is when either of these functions are not done properly. The patients could have different types of heart failure. Either the heart is too stiff and then it can get filled by blood, or the heart is weak, meaning the contractility of the heart is lower than normal. Once the contractility of the heart starts to decrease because of heart failure, one of the initial response of the heart is to get dilated, because if it's pumping less blood, so what it tries to do is to grab more blood, so that even though if it's pumping 20%, the 20% of 100 is more than 20% of 50. So as it gets bigger, one of the most common things that we see is that the valves that are attached to the wall of the heart, they get pulled and they can't close well. So then they start getting leakage of these valves, and that makes the heart failure symptoms worse. So it becomes a vicious cycle where patients can't get out unless they get treated. Some of the most common symptoms are shortness of breath, fatigue, weakness, or swelling in the legs, basically signs of fluid buildup or fluid retention that you can see as swelling in your legs or bloating in your belly. That fluid retention is related to the inability of the heart to pump blood forward, so things start to back up and build up. So what can you do about it? Everything starts with lifestyle changes. There are many lifestyle changes that we can make to help decrease symptoms and decrease the work of the heart and decrease the risk factors that make patients prone to get heart failure. And while everyone can benefit from lifestyle changes, your genes also play a very important role. If you know that there's already history of heart disease in your family, it means that maybe those lifestyle changes should start earlier, and it means that you need monitoring and screening with a physician to make sure that you don't develop heart disease, or at least detect it earlier. So there's different stages of heart failure, which are based on symptoms and based on the responsiveness of the patients to different treatments. Usually, if a patient has symptoms, they have indication to be on these 4 types of medications, 4 different groups. And we use 4 because there's data that shows that using the combination of 4 is better than using 1, 2, or 3, because they work in different places and the benefit of one adds to the other. In another video, a pharmacist will break down in detail some of the different medications that we use to treat heart disease. Depending on the stage of heart failure that goes from A through D, so 4 different stages, the treatment will vary. Based on these stages, you can know if there's been reversibility or not. For example, the patients that are on the last stage of heart failure, stage D, are those patients that we've treated with everything: medication, lifestyle changes, devices, and they continue to have symptoms. The earliest you diagnose heart failure, before the patients have symptoms or have already involvement of other organs, the easiest it is to treat and the higher likelihood of reversibility.
It may feel overwhelming.
But remember, with every step that you take to raise health,
You're that
Much closer
to your heart healthier self.
And feel free to sign up for any of our virtual cardiac rehab classes here.